New York has become the epicenter of the nation's monkeypox outbreak. That's according to New York City health officials. Kevin Uretsky has more on the story from New York City.
Monkeypox cases are on the rise, and health officials are becoming increasingly concerned. The World Health Organization says cases globally rose 30% in the past 2 weeks, with Europe seeing the vast majority of those cases, responsible for 80% of the new infections across the globe.
Across the world, there has now been more than 6,000 cases recorded in 58 countries.
The UN says expanding vaccination efforts and improving monkeypox surveillance will be crucial to curtailing a future outbreak.
WHO is working with countries and vaccine manufacturers to coordinate the sharing of vaccine, which are currently scarce and need to be accessible to the most at-risk people.
Meanwhile, New York City is now being dubbed the epicenter of the monkeypox virus here in the U.S. Health officials say the number of probable cases increased to more than 119 as of this week. The city now plans to open several pop-up clinics to administer vaccinations in the coming weeks. Despite this, the New York City Health Department is pleading with the CDC to send more doses to meet the increased vaccine demand.
We'll certainly need much more vaccine and quickly to meet the burden of disease here in New York City, the epicenter of the monkeypox epidemic in the United States.
The supplies are currently small, but we also want people to understand how to identify monkeypox, how to seek diagnosis, and how to avoid exposures themselves.
Monkeypox symptoms include headache, muscle aches, and fever, along with lesions on the body. If exposed to the virus, you should isolate immediately and contact your local health provider.